We'll start by talking about solutions when monopoly is natural, and those solutions will be in the form of basically regulations and subsidies. So we'll start by talking about when monopoly is natural versus unnatural. We'll talk about the ideal solutions to the natural monopoly problem and why these ideal solutions fail. We'll then talk about second best solutions, in particular average cost pricing, and other reasons other than regulation why natural average cost pricing could arise. We'll talk about the distortions that are caused by average cost pricing and the dynamic distortions as well as the static distortions. We'll then talk about how selection relates to the distortions of average cost pricing. Selection we talked about in the cost lecture, that different customers can have different values or costs to the firm. And then we'll talk about the empirical applications of that to insurance markets, as well as a little bit of policy stuff related to Obamacare and recent debates about policy towards insurance markets. Okay, so today we're going to focus on natural monopoly, but monopoly can also be caused by forces other than quote-unquote natural forces. And Maury, what are some of the non-natural causes of monopoly?
Like, would intellectual property be one?
That's one. Can you think of others?
Like government-run monopolies?
Yeah, so those are two good examples. So intellectual property, either by patents, copyrights, trade secrets, or government protection. And that will be the focus of maybe not the next lecture, maybe the lecture after that. Lobbying for protection from the government. Another form is private or illegal violence. That's very important for the mafia, for drug gangs, etc. And they often control sin industries or gambling that way, as well as illegal industries. And the right solution to that sort of monopoly problem is basically law enforcement, right? And there are also temporary advantages that people can get by being the first to the market, and this tends to resolve itself over time. And transparency or lower bureaucracy for entry, other things that aid entry can help resolve that. Yeah, Rishi?
Could you be an example of temporary advantage?
Yeah, very temporary. Yeah. Yeah, Evan.
Would collusion be considered in this category, or is it something else?
That's a good question. Where would I put collusion?
Is collusion classified as monopoly, or is
Well, it can be if it's perfect collusion. It's usually not perfect collusion, so it's usually not exactly the same. But, yeah, I mean, you could think of that as in some sense private or illegal violence. Like, it's like they have some contract that they're enforcing to close the market. Yeah, Philip.
I guess I was thinking about collusion created by one company, like buying up all the others. Although I suppose that if there was still free entry, it couldn't gain.
Well, that's related, but again, I think that the reason I would classify that in with private illegal violence is that law enforcement is really the way to get deal with that, and law enforcement against mergers, law enforcement against collusion, etc. So, okay, but things are a little bit trickier when monopoly is natural or inevitable. And Christian, what does it mean for a monopoly to be natural?
It means that your long-run average cost is decreasing. So basically there's economies of scale, so it's most efficient for just one firm to produce all of them.
Yeah, so that's sufficient condition, but actually you can get you can get natural monopoly even without that. So in particular, if there are if you have what's called sub-additivity, even if you don't have economies of scale throughout the whole range, you can get a natural monopoly. So if the average cost curve is like that, so there's economies of scale over here but not over here, and demand cuts there, then it's cheaper to have one firm producing than to have two firms producing, where they'd have to produce at a higher cost, even though there's not economies of scale through the full range. Does that make sense? Okay. The key question is whether there's economies of scale over the relevant range and up to the relevant point where demand cuts. So that can mean that even at the point of demand, there's a little bit of diseconomies of scale, as long as there's enough economies of scale over to the left to compensate. Okay, so Ming, what are some examples of a natural monopoly?
Electric utilities and stuff, and social
Yep,
telephones.
those are good examples. Social networks are another natural monopoly because everyone wants to interact with each other on one network. Monitoring of income is another thing that I think is basically a natural monopoly, because once I'm monitoring one person's income, it's much easier to monitor another person's income than to do that separately, because I can sort of, if I'm monitoring everybody's income together, I can check that all the numbers line up with one another, because the income has to be going from somewhere to somewhere else. And so I think that's an important reason why government centralizes the collection of taxes rather than farming it out to a lot of private companies. Public transportation in many settings is a natural monopoly as well, because you don't want to overlay the public transit network. You just want to have one set of things operating there. Okay, so here is a picture like I drew here, where even though there's diseconomies of scale, it would still be more expensive to have two firms producing, right? Okay. So the simplest solution to the natural monopoly problem is just to mandate that prices are at average cost, marginal cost, sorry. But usually, if we have economies of scale through the full range, marginal cost will be below average cost at the point that you want to mandate. This follows directly from there being economies of scale, and thus marginal cost pricing would require a subsidy. And that would require that the government pours some money in, not just that it forces prices down, but that it also raises tax revenue and gives that as a subsidy. And that tax would have to come from some or all consumers via, say, an income tax, a sales tax, etc., which we'll talk about those types of taxes more in the lecture on redistribution. So some examples that are like that is that much public transportation actually makes a loss. The Postal Service makes a loss. Most government services make losses in order to provide things at marginal cost, or sometimes even below marginal cost prices. Yeah, Christian?
So like the thing we drew there,
Yep.
with the slight diseconomies of
Yep.
scale, would marginal cost pricing still be better? Because marginal cost is actually...
Yeah, so there's actually going to be two. We'll talk about this in a minute. But if you think the marginal cost curve is going to come... So, marginal cost might be like that. So actually, there's going to be too much production if you had average cost pricing here. Marginal cost pricing would actually lead to a higher price and a lower quantity. And we'll talk about that in a minute, actually. Okay, so all of these solutions, however, require a lot of information. So if we want to do marginal cost regulation, we're going to need to know the whole cost curve, right? Because we need to regulate things down to cost, and not just to average cost, which we could check by auditing the firm's accounts, but we need to know what is their cost if they expand by one more unit, right? And then we have to determine the subsidy, so we need to know average cost as well, right? And this information problem is pretty severe, because if the price that's charged is determined by marginal cost, then the firm has a huge incentive to just raise its inframarginal costs in order to obtain more subsidy, right? Because that isn't even required to raise its price in order to do that, right? If it just says, oh, we had all these inframarginal costs, they can just load up the government with a huge bill, and that has no impact on how much they're even selling in the market, or whether they're able to operate. So that can be a major problem. Another approach that we could take was we could give Pigouvian subsidies, right? But this would require knowing a fair bit about demand. We wouldn't need to know the whole demand curve, but we would need to know its slope, because the subsidy that you need to give, remember, is equal to the marginal consumer surplus, which is equal to the slope of the price curve multiplied by the quantity. So we need to know that. Or another solution, which we'll talk about in the next lecture, is allowing the firm to perfectly price discriminate. But that would require knowing all of the consumers' willingness to pay, the firm knowing all the consumers' willingness to pay. And if we didn't want the firm just to make all those profits, we need to have some way to extract that total willingness to pay from the firm via some sort of competitive bidding, which would require that there be a bunch of people who know what it's worth to have that monopoly. So that's again another reason why marginal cost pricing or any other perfect solution to monopoly is difficult. Finally, there's a major question under marginal cost pricing as to whether the service is worth creating at all. If you charge marginal cost prices and there's positive demand, but the firm is making a loss, you have to give a subsidy, and it's not clear whether the consumers would have been willing to pay for the service at all, right? So imagine that there was a situation where, average costs were like this, marginal costs were like that, and demand was like this. Well, then clearly it's not worth creating the service, but at marginal cost pricing you couldn't know that, because you wouldn't know that the demand curve was like sitting all the way below the average cost curve. Yeah?
Can that happen even when there was previously an equilibrium in the markets? Like the
No.
monopoly was pricing above cost? Okay.
No. So, but you'd have to like have some mechanism where the monopolist, okay, so here's how it could happen, Julian. So the monopolist, if he anticipates that you're now going to afterwards bring him to marginal cost pricing, he might be willing to like charge some price and pretend like there was a market, right? And say that he was making like profits, but actually he was making losses, so that you would then bring him to the situation where he gets subsidies. So you'd have to do that for quite a long time, and you'd have to be forced to take losses for quite a long time in order to screen that out. But that would also require having monopoly pricing for a while. So, yeah. Okay. So, another problem is what's called regulatory capture. So that's the idea that regulation can easily become a means of corruption if you're giving all these subsidies, because the regulators can become sort of cozy with the regulated firms, and because consumers are diffuse, it's hard to monitor that the regulators are actually doing their jobs. And there's quite a lot of evidence that this happens in practice, though organized consumer groups can help combat this. And this tends to happen most when things are very opaque, when it's hard for consumers or outside individuals other than the regulator and the firm to know what the firm's costs are, right? And Austin, in what sense is this just another version of the information problem?
How is it similar to the information problem? Well, I guess it's similar in the sense that this whole asymmetric information between the regulators and the regulator makes it easier for them to kind of get away with it. And also between the regulators and the people that they're supposedly accountable to. Yeah,
I think that's the most important thing, is that really there's an asymmetric information problem between the regulators and the regulated, but if they're cozy with each other, well then the real asymmetric information is between both of them and whoever is monitoring them, the consumers. So in some sense, the regulatory capture problem is really just another version of the asymmetric information problem, and therefore the way to combat it is to try to have transparency as much as possible, or some ideological group that's in charge of monitoring those regulators that has interests closer to the consumers. So for example, I think one reason that environmental regulation works quite well is that there's all these environmental lobbying groups that sort of monitor to make sure whether the EPA and other groups are doing a good job. And not only are there those groups, but there's people to even monitor those groups, which is that there's a whole environmental movement, and people know about what's good and bad for the environment, and you learn about that in schools and so forth. All that information that people have is what keeps environmental regulation working well, and what makes financial regulation, for example, work so poorly is everyone thinks finance is just complicated. They don't know they don't like, bankers, but they don't know exactly what they don't like about them. People don't really have any coherent thing, and I think that's the reason why financial regulations work so poorly and will continue to until we build that sort of a movement. Yeah, Austin.
So I know after the Deepwater Horizon disaster, they were talking about this whole regulatory capture problem.
Yep.
Would you say then that core reason for that would just be because the whole like ultra deep water drilling is so complicated, nobody understands it. So even though everybody, like environmentalists,
Yeah,
still don't
I think that the more complicated something is, and in fact, people create complexity precisely in order to try to, stymie the So I think there's a case for keeping the way that something works relatively simple, precisely for the purpose of allowing transparency all the way back to the public. Okay, so to address some of these concerns, in practice, it's more common to use average cost than marginal cost pricing. This is also called rate of return or cost plus regulation, because usually the firm is allowed to earn some quote-unquote profit, but that's not really economic profit, it's just the return on the capital investments that they made in the past. And these profits are capped at some low rate to cover the investments that were made. And a simple static model of this is just average cost pricing. Now, let's talk about what some of the benefits of average cost pricing are over marginal cost pricing. We'll soon talk about some of its costs. Joan, what are some of the benefits that you think average cost pricing could have over marginal cost pricing?
It would probably be easier to calculate the average cost. You don't have to discriminate over something.
Yeah, that's right. It's easier to audit. Also, it doesn't require subsidies from the outside because the firms don't take losses, and that makes it easier politically, and it helps with other issues. It makes it less easy to corrupt, for example. One only really needs to know the average cost at a single point. You don't need to know what the whole curve looks like. And if consumers are willing to buy at the average cost price, then the product must have been worth creating, right? So average cost pricing lessens the information problem along a number of dimensions. So to implement average cost pricing, we usually use in the West, in OECD countries, rate of return regulations on private companies, but sometimes you could also use state ownership. Example of a private regulated firm is Edison, which does the electricity here in Chicago. And ComEd is a firm that owns a bunch of different utilities in different parts of the countries. And there's regulatory boards, either state, local, or federal, that oversee these things. And they're usually made up of experts. So for example, the Illinois Commerce Commission is the one that regulates ComEd. And sometimes there's an initial auction of the rights to run these sorts of concessions. So the Federal Communications Commission does this with the rights to the spectrum. And then there's an extensive team of auditors that monitor prices, look into the costs of the firm, and they usually have a lot of economists as well. Now, these institutions usually have some combination of both economic and political goals. Political goals include environmental protection, equity, so making sure the poor don't have to pay as much, as well as the protection of some politically important groups. Yeah, Evan, did you have a question?
Yes. How do they avoid collusion in these auctions?
Oh, well, we'll talk about collusion in auctions later in the course, but there's lots of theory about dealing with collusion in auctions. I mean, that's not to say they always implement an auction that's robust to collusion. Sometimes they do one that's very collusion-proof, partly because of prone to collusion, partly because of regulatory capture. But there are certainly strategies for trying to avoid collusion in auctions. Okay, so average cost pricing is actually quite common in a bunch of areas of the economy. Mike Fosco, could you give some other examples of where average cost pricing is used?
I assume monopolies that we have for the government, that it's not worth the marginal cost of utilities maybe, or pipelines.
Yeah, so what was the second example you gave?
Pipelines.
Pipelines are usually privately owned, actually.
Well, then the electricity.
Yeah, so we just talked about electricity. Can you think of any others?
I mean, intellectual patents, maybe.
But those aren't regulated. So those are, people can charge whatever price they want for those.
No, I can't remember.
So, I mean, there's other utilities, right? Like water, heating, etc. There's also public transit infrastructure. So some of that is charged at marginal cost prices, but some of it's actually required to make back the costs of building it, and so they're allowed to charge higher prices to make it back. Telecommunications has been, in the history, regulated according to average cost. So in the United States, AT&T used to be an average cost regulated monopoly in the United States. And then it was broken up in the 1980s to create competition, but now they've all merged back together, and we're getting back to maybe an unregulated monopoly. And more broadly, sometimes you can bring lawsuits, especially in some developing countries, against firms for excessive pricing or earning too much profit. And effectively, that acts as an informal form of average cost regulation. Okay. So average cost pricing can also result from free entry, right? If anyone can enter into the industry and there are a large number of equally able managers, it's not rocket science to figure out how to run the firm, and there's no barriers to entry, then anytime a firm is making profit, we should expect that to bring an entrant. And some firms might even try to price lower, close to average cost, so that they don't have a lot of profits that would tempt in an entrant to come and enter against them. So some have argued that equilibrium must therefore involve zero profits and average cost pricing. This is a very common assumption in many economic models. As we talked about earlier in the course, I'm not sure it's that realistic because of firm heterogeneity that might make it hard to imitate the best firms. But it's often a reasonable benchmark way of looking at things. So sometimes we get average cost pricing not from regulation, but just from the competitive process. And the key problem with that is that average cost pricing is not the same as marginal cost pricing, and therefore average cost pricing will not be efficient. So when marginal cost pricing leads to losses because marginal cost is below average cost, then average cost will be above marginal cost by definition, and therefore average cost pricing will lead to lower quantities and higher prices than marginal cost pricing will do. And that will lead to a distortion, a downward distortion in the quantities. And that's not dissimilar to the monopoly distortion, but it's usually not as extreme. The wedge, rather than being between price and marginal revenue, is between average cost and marginal cost, which actually looks quite a bit like the wedge between price and marginal revenue. It's equal to the negative of the slope of the average cost curve times the quantity, the same way that it was the negative of the slope of the price curve times the quantity for the monopoly distortion. Now this, in turn, depends on the size of the market and the slope of the average cost curve. But remember that it's also possible to have marginal cost that's above average cost, and we'll talk about that in a minute. But let me first just show you a picture of this. Yeah, Philip?
I didn't see any reference to the slope of the marginal cost curve in that equation.
Yes.
Would that be relevant, potentially?
Not necessarily. So it's actually, no one ever draws pictures this way, but it is possible to have, for example, in this picture, marginal cost curve that's increasing and yet still is below the average cost curve, and that can lead to that can still lead to exactly the same issues. Yeah, Bharat.
So in the example of like ComEd,
Yeah.
there's also like, I guess, externalities of like producing, like you might want to produce less for it to be socially optimal.
Because of carbon.
Yeah.
Yeah.
So in that case, would that like favor marginal cost pricing as opposed to average cost pricing?
Well,
Because-
that would lead to you to favor average cost over marginal cost because average cost is higher than marginal cost, typically.
Oh, right. So in either case, there's still like a distortion in like the optimal quantity, right?
Yeah, I mean, usually we try to address these things separately by like having a Pigouvian tax plus, cost pricing. But yes, in principle, those two things can cancel out to some extent. Yeah, Rishi.
Sorry, in the last slide, you know something about the Harberger Triangle?
Yeah, Harberger Triangle is what's here.
Oh, okay.
So here's where the demand curve meets marginal cost. That's the socially optimal point. Demand curve meets average cost as the equilibrium point, and there's this distortion between them, which is this Harberger Triangle. Yeah, Philip?
I think what I wanted to say is if marginal cost instead was just a flat line through E, then the distortion would be different. In this case, it would be bigger. So intuitively, it seems like the distortion should depend on the slope of the marginal cost too.
If it was flat through E. Yeah, but if it was flat through E, then the average cost wouldn't look like it looks like.
Oh, I see. The average cost will capture this. Okay, that makes
Yeah.
sense.
Okay, so most classical distortions, this is the most classical distortion and the one that's talked about most, but, and maybe it's most important, but there are other distortions that can come from average cost pricing. So one thing is that the market could fail to exist at all. And Ming, how could that happen?
Sorry?
The market could fail to exist at all because of average cost pricing, even though it would be socially efficient for it to exist. How could that happen?
Sorry, I'm blanking right now.
Does anyone else want to try to discuss that? Yeah, Philip.
In an insurance market, if heterogeneity.
Well, let's not talk about insurance markets. I'm just talking about average cost pricing now, like in a context of a monopoly. Yeah, Wesley.
Well, I mean, on that graph, the second graph on the board, you had a demand curve that didn't intersect average cost. So then.
But that was a case where it wouldn't have been valuable to create the market at all, right?
Right. So the firms wouldn't see a reason to enter the market.
Yeah, but that's not bad. That's not a distortion, right? Because, so that thing is what we would call a white elephant. A white elephant is something where, like, it's not even worth creating at all. But, if you didn't have...
But here it's worth creating, but they won't do it.
Yeah.
Okay.
So how could that work? Yeah, Adam?
Well, if it was like maybe above the, because ours like goes below the marginal cost.
Yeah.
Maybe if it was like above that, but then below the average cost curve, then there would be a social benefit.
Yeah, that's absolutely right. So with average cost pricing, there's no entry if demand is below average cost, but that doesn't necessarily mean that there's no social value, because demand could be below the AC but above the MC. So in particular, what you need to construct is something called the average utility curve, which bears the same relationship to the demand curve that the demand curve bears to the marginal revenue curve. In particular, it's the gross consumer surplus divided by the quantity. And comparing this to average cost determines whether the market should exist at all or not. So basically, the average utility curve would be up here, and then even if there were some fixed cost which caused the average cost curve to look like that, you could figure out whether the market should exist by whether there's a point where the average utility curve lies above the average cost curve. So if the average cost curve is above the demand curve, what you get is called a death spiral. So imagine that the quantity in the market were this. Well, then, in order to break even, the firm would have to charge this price, right? But then that would mean that the quantity would be this. But then it would have to charge this price. And so forth. And it collapses down to zero. Yeah, Austin.
Are there any real examples of death spirals?
Oh, yeah, we'll talk about a bunch of those soon. But I mean, there's certainly goods that could be created where there's no way you could make profit off of it, enough profit to compensate it, but it would still be worth creating. I think a lot of drugs are like that. Because the thing is, any price you charge, you don't make back your revenue, but the total value that you bring to consumers is greater. Yeah, because the thing is, there's all this inframarginal consumer surplus that you're not capturing. So unless you can perfectly price discriminate, that can definitely happen.
So is that the reason for orphan drug pricing?
Yeah, I think,
Legislations?
well, I mean, but the thing is you need to give subsidies to the firms to research them. You know what I mean? So, but that's one reason why I think we give subsidies to R&D, is exactly that. Yeah, Tanner.
When you say inframarginal, what exactly does that mean?
Inframarginal means people value the thing more than they're paying for it. So they're not a marginal consumer, they're not someone who's just indifferent, they're someone who values it more. Yeah, Philip.
Are there situations where average cost pricing causes a death spiral, it's possible to have a stable monopoly price that results in the market existing?
No. So we'll talk about that in a second, actually. I think we're going to talk about that in a second. Let me just see. Okay, so no, it's not. And the reason is that if the monopolist will never charge a price where he makes a loss. If he were to charge a price below the average cost price, then he would have to take a loss, right? And no monopolist would ever want to take a loss. So monopolies will always charge prices that are weakly above the average cost price. And therefore, anytime average cost pricing leads to market collapse, monopoly also leads to market collapse. So the monopoly is always going to be at least as bad as adverse selection. I mean, as average cost pricing. Okay, so now if marginal cost is greater than average cost, there will also be a distortion. And what's the nature of that distortion, Austin?
So that would be basically excessive supply?
Yeah, that's right. So why is that?
Well, with marginal cost above average cost, they would continue to produce utility or sets, which would be at a greater quantity than is socially optimal.
Yeah, exactly. So this leads to excessive oversupply. So here's an example of this. So if the average cost is increasing and the marginal cost is above the average cost, then there will be average cost pricing will lead to too much supply in the market. Okay, so at least as important is the effect at least as important as these static distortions is the effect that regulation has on longer term incentives. So companies can often easily affect their costs by making efforts to cut costs or to cut workers that are not necessary, by innovating to create more efficient production processes, by choosing cheaper over more expensive inputs. And 2 years ago, the problem set, how do you guys look at this? But unless all of these things are controlled or monitored by a regulator, the firm is going to have no incentive to reduce costs if they're getting average cost pricing, right? In fact, if the regulator tries to learn about what your cost is in order to regulate you, you might actually have an incentive to increase your costs. So an example of that is that my father once worked for a defense contractor, and this defense contractor was like pitching a weapon system to the government. And he found out a way to bring the weapon system about 50% under budget. And he pitched it to the general who was in charge of the project. The general said, I would be derelicting my duty to my country if I didn't spend every penny that was budgeted for this project. And the reason was that he knew that Congress would reduce their budget if it realized that you could do it more cheaply, right? Now other causes of average cost pricing can have similarly perverse effects. So if if average cost pricing just results from free entry and competition, no company is going to want to innovate to reduce its costs because it knows that other companies will just enter and eliminate the profits that it makes off of that, right? And we'll talk about ways to deal with that in lecture 13. Now, one important source of nonlinear costs is selection. And this is something we talked about in the lecture on costs, right? In markets where different consumers have different values to the firm, the cost curve for the industry as a whole will be not flat. So consider the cost to the government of covering everyone in society for insurance. And let's let Q be the fraction of people that are covered, and let's let P be the prevailing price, right? We can then create a demand curve which corresponds to if the price is this, what fraction of the population will get coverage, right? And the cost curve is not going to be linear because the first people that want insurance, that are willing to pay a lot for insurance, may be more costly or less costly than the people who want insurance at lower prices. So in particular, there will be adverse selection if the riskiest people we say that there's adverse selection if the riskiest people, the most costly people, are the first ones into the market. In that case, what would be the slope of the curves, Austin?
The slope of the cost curves?
Yeah.
Would actually be down, wouldn't it?
Yep. Why?
Because as you basically exhaust the more risky people, you move towards less and less risky.
Exactly.
This is like the new healthcare legislation and how predicting young, healthy people are not getting insurance.
Yeah, absolutely. if there's advantageous selection, we say there's advantageous selection if the people who are first into the market are the most healthy. Austin, could you give me a story of why that might be the case?
So I could think in the case of like crop insurance, for instance, you have only the most educated,
Yeah.
most educated, most like well-versed farmers are the ones getting crop insurance because they understand the whole like cyclic nature of crops, and so they're going to be cheapest to insure. As you go further and further out, you get to like family farmers that just don't understand the long-term nature of what they're doing.
But why would those people be more costly? Oh, because they're just worse farmers, basically.
Most farmers
yeah.
versus the good people understand.
Yeah, another thing you could think that's similar to that is like if like it's the hypochondriacs that most want health insurance because they're afraid they're going to get sick, they probably also take the best care of their health, right? And of course, you get a mixture of these things over different ranges. Of course, this is the cost curve for the industry as a whole rather than for an individual firm. But because insurance is sort of a social concern, we can think of things in these terms. So then selection is really the slope of the cost curve. And the slope of the average cost curve is enough because that'll give us the wedge, right? Because remember that the difference between average and marginal cost is the slope of the average cost curve times the quantity. And this is exactly what that INOV 2010 paper that we talked about measured. So again, just to remind you of what we talked about when we did that, there was a large aluminum manufacturer that offered two different plans, like a low insurance plan that only covered minimal things and a high insurance plan. The first plan, and individual division managers within the firm were allowed to choose the price gap between these two plans. And they claimed that this was sort of random, that the managers just did it for whatever reason. I think that's a questionable interpretation. I'm not sure that it was really that random, but if this is right, well then those random prices will generate different fractions of people choosing the two plans. And you can look at both the fraction of people who choose the plans, but also at the claims of people to figure out whether that leads to higher or lower costs. And this allows them to draw out the average cost curve and therefore the marginal cost curve and to figure out the distortion. Okay, so just again, let's look at what they did. So they looked at divisions that charge different prices. They looked at the quantities, the fraction of people who choose the two plans based on that. Then they looked at the claims data and looked at the average cost corresponding to each one of those things. And they drew a demand curve. They drew a linear demand curve. I probably would have drawn something a little bit more concave. But anyway, they drew a linear demand curve through these points and a linear average cost curve that allows them to generate a marginal cost curve and to trace out the distortion associated with adverse selection. So if you just look at that picture, that seems to indicate that adverse selection is pretty small. I mean, there is some, but it's not a huge distortion, right? Quantity goes down to about 65% of people being covered from about 75%. So it's not like the market collapses or anything like that. And that was a little bit of a letdown when people found that, because people had been talking for years about these adverse selection problems, how they could destroy markets. It doesn't seem so bad here. But the question is, where is all the adverse selection that people had been expecting? So Florence, why do you think they might have found so little adverse selection in that study?
Not entirely sure, but it might have been just, sorry, I'm kind of not exactly thinking through this.
Well, so remember that was a market where there was insurance, right? And what would you expect to happen if there's really, really extreme adverse selection?
If there's already been a lot of adverse selection, then you would expect people not to offer insurance at those prices.
Exactly. So in some sense, under extreme adverse selection, the market would collapse. But if the market collapsed, we couldn't draw this picture, right? All the quantities would be down to zero, right? So the very fact that we can even draw this picture says there can't have been that severe adverse selection, right? And that's what Nathan Hendren realized. So he did something very clever to investigate this. In particular, he looked at markets where you can't purchase insurance at any price. Where if you have certain conditions, they just say, no, we reject you. We won't give you an insurance at any price. That was actually one of the issues that Obamacare was trying to deal with. And so he wanted to ask whether selection was the cause of that problem. And so he looked at a survey of individuals who had these conditions, asking them to reject how likely they thought it was that they were going to end up being hospitalized or getting sick or whatever. And then he looked at whether they actually got sick, and he correlated those things to figure out how much people knew about whether they were going to get sick or not. And he used that as a proxy for whether adverse selection was very strong or not, right? And in fact, you can do this with these average and marginal cost things. So what he did is he basically said, let's order everybody in terms of the chance of them getting sick. And let's say, if we were to charge this much for insurance, what would be the average cost of people who would be willing to buy insurance at that rate? And he used that to figure out basically how large of a tax premium you'd have to pay in order to get insurance, depending on what these distributions of private information were, right? And in particular, you do that on the first unit of insurance, because if you have such severe adverse selection on the first unit of insurance, you wouldn't expect people to have any insurance at all, right? And so here's what he found. He found that if you look at things where there wasn't rejections, where you could buy insurance if you paid enough, the private information looked like this. It was pretty tightly clustered. So, if these people were buying insurance, well, the average would only be around here, right? Average cost. And if these people were buying insurance, well, the average cost would be around here. On the other hand, if for the areas where people were getting rejected, if these people were buying insurance, well, the average cost would be up here, right? And that would be really, really high. And so he showed that basically the effective tax you have to pay on insurance is about 75% in the markets where people got rejected, and it was all around 10 or 15% in the markets where people didn't get rejected. And that roughly corresponds to these pictures over here where the wedge was quite small, right? Yeah, go ahead. So.
I'm a little confused about how you were computing costs there.
Yeah.
What does the x-axis represent?
So this is basically how sick you expect to get. And so imagine the people above this point are the ones who are buying insurance. Well, then the average is not going to be that much above the marginal. But here it's going to be massively above the marginal. Right? Yeah, Evan.
So wait, this is what they estimate their probability is?
Of getting some bad condition. Yeah. Yeah, Philip.
What are you talking about exactly when you say tax?
Tax is this wedge. It's like this difference between average and marginal cost. Because the thing is, your cost is only the marginal cost, but you're forced to pay the cost of the average person. So it's effectively like a tax on insurance.
So is the difference between the dotted line and the solid line the wedge?
No. The difference between the wedge is at this point, what would be the average cost of people who have a higher cost than you? That's the wedge. Because you're forced to pay for them rather than for yourself. Okay. So the same types of approaches that we took to solving market power problems, to solving the monopoly problem, can solve the average cost distortion here. So if we wanted to have something more like marginal cost pricing, we'd have to do things similarly here. So for example, we could give subsidies for buying insurance. Ming, why would that create some of the similar problems that we discussed marginal cost pricing creating previously?
So previously we discussed that subsidies for marginal cost pricing would be problematic because of the lack of information we have about the cost functions of the
Yeah.
tariffs. So I guess a similar thing that we would not have very good information about what exact cost we're dealing with when we want to subsidize people.
Yeah, so people often advocate giving subsidies for insurance, but this requires you to know what the marginal cost curves are currently, which we have really no idea. So when they set up Obamacare, they set these subsidies, but who knows what the right subsidies were? They just sort of made them up, right? Another thing you can do is have a mandate for universal coverage. And Mike Fosco, what are some of the problems that you think that might create?
Well, depending upon the price, if you're doing the average costs, then you're not really, you'd have to price discriminate for everyone, and then they have to accept all.
But what if you just forced everyone to buy insurance?
So
What could be bad about
the
that?
bad people in there, but then the people who are healthier would have to pay a higher price than they would have to.
Yeah, but that's not socially inefficient necessarily. So the question is, what would the social inefficiency be?
That there's an oversupply for the people who don't want it.
Yeah, so the big thing might be that it might not be optimal for everyone to get insurance, but some people might have a lot of moral hazard. Like insurance might make them like way over consume healthcare, right? And that might be a real problem, right? And so it might be inefficient for them to get insurance. Like they might not have very many risks, but if they get insurance, they might like take advantage of the medical system in all sorts of ways, and they would know that it's not efficient for them to get healthcare, but they would now be forced to, and then they would waste a lot of money. So that's a major problem. Cost-based discrimination is another thing we could do. We could charge different costs to everyone, different prices to everyone based on their like expected costs, and that could reduce the possibility of adverse selection. But Philip, what problems do you think that might create?
Well, it's as shown in that diagram with the residual private information, even when the firm tries to get as much information as possible, they still don't manage to extract everything because the consumer manages not buying something.
Yeah, so that's one good thing, is that like consumers might know more than the firms know. But another problem with it has to do with distribution, right? So if we charge everyone the costs of insuring them, that can defeat a lot of the point of having insurance in the first place. So imagine you don't have long-term insurance that lasts your whole life, but it's every year. And every year, based on whatever conditions you have to pay a different premium. That would be a mess, right? Because then if you got cancer on December 15th, you would suddenly have to pay for the full cost of your cancer treatment, right? You wouldn't get any of the benefit of having insurance. So like, it sort of defeats a lot of the purpose of insurance to have that sort of pricing. Anyways, we're done really early today. So anyway, I'll make it up at the 9 p.m. on Monday when I'll answer your questions about the midterm. If you have any questions about the midterm, you can ask them now as well. And otherwise, good luck studying.